the ending of the worst chiropractor
I'm guessing you've never been to a chiropractor before?
in the USA. So if you haven't seen the first 3 parts yet,
I don't treat anything.
make sure to check them out
Pull. Okay.
because they'll provide you with important information
I just made you gluten intolerant.
to better understand this final chapter.
Before I came in, I was checking out some of your reviews and I saw people were mentioning, a lot of kind of, negative thoughts. Have you seen some of those?
No, I don't normally go on and take a look at those reviews.
Totally.
Okay, you're gonna feel a quick tap here.
And is any of this going to result in a crack? Or I shouldn't expect that necessarily?
You shouldn't expect it necessarily. A lot of chiropractors twist necks and backs and they want to hear a crack.
Yeah.
There's nothing wrong with that necessarily.
It is important to understand that chiropractors are not required to perform adjustments or joint manipulations. We can use various techniques, such as mobilizations, soft tissue work, and passive therapies. In other words, it is not necessary to manipulate or adjust a patient to provide relief. However, if the patient's therapeutic expectations include a manipulation and there are no contraindications,
I was looking to be adjusted, and instead he told me I need to forgive myself.
while respecting the patient's comfort zone, there is no reason not to proceed. Not performing an adjustment
I was looking to be adjusted,
could even diminish our clinical results,
and instead he told me I need to forgive myself.
as it would not address the initial needs of the patient when they sought care. It is also essential to understand that even during a neck or back manipulation, there may not be a cracking sound. For a cracking sound to occur, the joint must be taken to its anatomical limits, which increases the pressure inside the synovial joints and causes the noise you hear. However, sometimes limitations in a region or muscle tension can prevent us from achieving maximum range of motion, thus hindering an effective adjustment and the associated cracking sound. Moreover, there are patients who already exhibit good mobility in all directions, making it difficult to isolate a segment for manipulation while respecting the normal anatomy of the joint. Furthermore, if everything moves well in all directions without restrictions, there is no need to adjust, let alone repeat with more velocity solely for personal satisfaction.
Because one person, I guess, was trying to say, if a chiropractor isn't going to crack your back, are they a chiropractor at all?
The reality is bones only misalign a millimeter. And if you're wanting a bone to pop, you potentially could be creating a problem for this patient.
Once again, the myth of misaligned vertebrae lacks foundation, as your anatomy is unique with all its normal and benign subtleties. It is dishonest to suggest that cracking could harm the patient.
If you're wanting a bone to pop, you potentially could be creating a problem for this patient.
If performed within the comfort-uncomfort zone and with no contraindications, it becomes an important tool that often aligns with the expectations and therapeutic values of patients.
I was looking to be adjusted.
One person was even, I guess, trying to compare it to card reading, tarot card. They said a glorified card reader.
Okay. Yeah, some people say that because they don't understand what's going on. But most people who have this done are just amazed at how much better they're feeling.
Never forget that personal experiences are not a reliable indicator of success.
Most people who have this done amazed at how much better they're feeling.
It's impossible to compare an individual positive experience with the unique complexity of pain and its subjective nature. If it helped you, that's great, but we cannot extrapolate that to a larger population. Realize that many effective practices, whether from a chiropractor, physiotherapist, osteopath, acupuncturist, etc., utilize a wide range of techniques, yet all can achieve excellent clinical results.
Amazed at how much better they're feeling.
This leads us to consider that it is not so much the therapy itself that makes the difference, as everyone can help alleviate neuro-musculoskeletal pain. What truly matters is attentive listening to the patient, a meaningful explanation that restores autonomy, an approach that aligns with the patient's therapeutic values, and a multitude of contextual factors that maximize our results. Among these factors are lighting, plants, music, and touch, all of which contribute to optimal clinical practice and a healing-friendly environment.
So you're not evil?
I don't think I'm evil, no. No, I don't think so, yeah. What I try to do is get my patients well, and that's what I'm concerned with, and that's what I focus on.
Well, you can't fault a doctor who cares more about his patient's well-being
than his 1-star reviews.
And that's an excellent message to conclude the video, because even if a therapist uses pseudoscientific or dubious techniques, most do so with good intentions.
What I try to do is get my patients well, and that's what I'm concerned with, and that's what I focus on.
And are convinced of the validity of their claims, even if they are incorrect.
I just made you gluten intolerant. Me? Yes.
This sincere desire to help and relieve, even if it's not always based on the best scientific evidence, can still play a role. However, have you ever wondered what the worst mistakes to avoid are when dealing with persistent pain to recover faster without even needing to consult a healthcare professional? The answer is in the link that should appear right now. This link will guide you to essential tips for better managing your pain and speeding up your recovery.